What is diabetes? There are 850,000 people here in the UK who are currently living with diabetes but yet to be diagnosed. Could you be one of them? Can be a life-changing condition. Make sure you know what to look for and, more importantly, what you can do about it. My name is Dr. Zulqarnain Ahmed. I'm a GP in Bolton and I make videos about health and self-growth. Welcome to the channel. Diabetes is a serious condition where your blood glucose level is either too high, and it can happen when your body doesn't produce enough insulin and the insulin it produces is ineffective, or when your body can't produce any insulin at all. There are two main types of diabetes, type 1 and type 2. When you got type 1 diabetes, you cannot make any insulin at all. And if you got type 2 diabetes, it is a bit different. The insulin you make either can't work effectively or you can't produce enough of it. They are slightly different conditions and they're both serious and you need to do something about it. And there are other types of diabetes, for example gestational diabetes, but we're not going to talk about them here today because they constitute a very small number of people. So first of all, it's important to understand what causes high blood sugar levels. So actually what happens is when we eat, food is digested into the gastrointestinal tract and is absorbed into the bloodstream. The bloodstream senses the rise in glucose level, and as a result, body produces a hormone called insulin from an organ called pancreas. When insulin is released into the bloodstream, that opens up the small door into the cells, and as a result the glucose moves into the cells. Hence we are able to use it as a fuel. However, in case of diabetes, either the insulin which is produced is not effective or it's not the right amount. And in case of type 1 diabetes, it can be completely absent at all. So as a result, there's more glucose in the blood. So thinking about here in the UK, there are more than 4.9 million people here in the UK who have diabetes. And there's 13.6 million people are now at increased risk of type 2 diabetes here in the UK. You're more at risk of type 2 diabetes if you have a close family member who has diabetes. Type 2 diabetes constitutes of the 90% of the total number of people with diabetes. Now, what are the common symptoms of diabetes? What you can look for? So the most common issue which people notice is that going to the toilet much more often than usual, especially at night. In addition to that, people feel really thirsty and also will feel more tired than usual, more lethargic, and you might start losing weight without even trying. And some people start to get genital itching, a thrush, common colds, a lot more than usual, and in rare cases cuts and wounds take longer to heal, and in very advanced cases it can also cause blurred vision as well. Over a long period of time, high glucose level in your blood can seriously damage your heart, your eyes, your feet and your kidneys. These are known as the complications of diabetes. But with the right treatment and care, people can live a healthy life and there's much less risk that someone will experience these complications. And if you're not sure if you might be at increased risk for diabetes, then go and speak to your GP or a nurse in general practice. And there's a simple blood test which can be done, and you don't have to fast for that test either. There are various treatments for diabetes, mainly in the form of tablets, and some people may need insulin. However, the good news is that if found early, there's a good body of evidence which suggests that you may not need any of those things. Research has consistently shown that for some people, combined lifestyle intervention including diet, physical activity and sustained weight loss can be effective in reducing the type 2 diabetes by about 50%, and more importantly type 2 diabetes can also be reversed. And if it sounds like something you might be interested in, then make sure you hit that subscribe button, and in the next video that's what I'll be talking about. So make sure you subscribe, and thank you very much for watching.